Most people have no idea that one of the most overlooked cancers in America hides right inside your mouth, and by the time it's found, it's often already too late to treat easily. Oral cancer is a serious health issue worldwide, and here's the part that really concerns me. When it's caught late, the chances of survival drop significantly, and the numbers back that up. In 2025 alone, it's estimated that nearly 60,000 Americans will be diagnosed with oral cavity or pharynx cancer, and close to 13,000 people will die from it. That's roughly one person every hour. So what can you actually do about it? What should you know? Two things. First, you need to team up with your dentist, because your dentist is truly your first line of defense. And second, you need to know what to watch for on your own. Let me break this down. Oral cancer tends to get diagnosed way too late. About 70% of cases are already at an advanced stage by the time they're discovered, and that dramatically changes the outcome. When caught early and still localized, the 5-year survival rate is around 84%. But if the cancer has already spread by the time of diagnosis, that number drops all the way down to 38%. And why does late detection happen so often? Think about it. How often do you actually look inside your mouth? Probably not very often. Your dentist, on the other hand, should be doing exactly that. If you're going in every 6 months, an oral cancer screening needs to be part of every single visit. So what does that screening actually involve? Your dentist should be checking all around, pushing your tongue to one side, looking under your lips, checking way back in the throat, pulling your tongue out and examining both sides, and asking you to lift it up. If none of that is happening, just speak up. Say, "I'd like an oral cancer screening done today." They can see things you simply cannot. Now, what should you be looking for at home? Watch out for ulcers that take a long time to heal. Look for raised red or white sores inside your mouth that stick around and feel tender. Pay attention to any swelling, difficulty swallowing, or persistent soreness at the back of your throat. The most common spots where oral cancer shows up are the tongue, along the sides and underneath, the roof of the mouth, and the inside of the lips. These are the areas you want to keep an eye on. What puts you at higher risk? Tobacco use is the #1 risk factor, especially smokeless tobacco, the kind people tuck right inside the lip. That tissue just isn't able to recover the way other areas can. Alcohol is the second major risk factor. There's also a strong and well-established link between oral cancer and HPV, the human papillomavirus. And don't underestimate the role of poor oral hygiene and gum disease. If your mouth isn't in good shape overall, your risk goes up. Now, I also want you to understand what treatment actually looks like if oral cancer is found, because knowledge is power. The most common treatments are surgery, radiation therapy, and chemotherapy, and they're often used in combination. The goal is always to eliminate the cancer while preserving your ability to speak and swallow as normally as possible. For early-stage cancers, surgery alone or radiation alone can be highly effective. Small cancers of the tongue, floor of the mouth, and inner cheek can achieve local control rates as high as 90% with either approach. For more advanced cases, treatments are combined. These treatments work by helping your own immune system recognize and fight the cancer. Medicine is moving forward, but early detection is still by far the best medicine we have. So here's what I want you to walk away with. Number 1, make sure your dentist is performing a full oral cancer exam every time you come in. Number 2, actually show up for those appointments. Every 6 months, no skipping. That consistency is so important. Research shows that people who visit a dentist regularly are less likely to be diagnosed with oral cancer, and those who do get diagnosed tend to catch it at an earlier, more treatable stage. Number 3, take a look in your own mouth from time to time. Pull your cheeks back, look under your lips, check under your tongue. And if you're doing anything that increases your risk, tobacco, heavy drinking, start thinking seriously about how you can change that. Give your mouth a fighting chance. I hope this has been genuinely useful to you. I don't want you to be someone whose oral cancer progresses to the point where it changes your life. My whole mission is to help you stay well. If this was helpful, please subscribe, share it with someone who needs to hear it, and come back often. I'm here to help you understand just how deeply your oral health connects to your overall well-being and how you can protect both.